which I understand. So I was like, all right. And my charge nurse was like, hey, I don't see anything wrong with her charting. Everything's here. She's been working in cases. She didn't even realize she had, you told that there was things missing, and the provider just wasn't listening. And he was just like, well, when I was looking at it, and I'm like, I don't know what to tell you. Like, everything was there. So they grabbed another provider who I was working with who I was working with in those cases, and he sat down, he looked over my documentation, and he's like, I don't see a problem. And when that was over, no one apologized, no one said anything. The manager just left, and I told the charge nurse that the doctor and the manager should apologize to me, because they basically took me to a small room, and accused me of not doing my job properly. I'm a person that if I'm not doing my job right, or I feel like I'm not confident enough, like I take it really hard and personal, and sometimes I cry because that's just my reaction. I just want to take care of my patients the best way I can and do my job properly, And I was just so upset because it's like they didn't look at my chart and like, just see that what he's saying is true. Instead, they just came to me accusing me of like not doing my job correctly, and it just didn't feel right. So of course this morning I spent putting an email and trying to be professional about it, but I just don't like that the way it was handled. And I get that, they want proper documentation, they want the reimbursement. I fully understand, but I feel like the manager and the charge nurse should have checked my documentation first, and then talk to me and it's like, hey, we noticed that these are missing. Can we, what can we do to help you? This provider is concerned that, you're struggling in this aspect, things like that.